Several MRI biopsy exams are scheduled for the day. MRI acquisition system and all material needed for the biopsy is prepared in advance. Dedicated MRI breast biopsy coil, grid compression kit, pillows, pads, cushions for patient comfort are in place. EnCor console is set up with the canister, cassette and saline. The 10-gauge probe tubing is connected to the MRI tube extension, which allows for the console to be placed outside the magnet room. Information is provided to the patient so that she is aware of the risks, benefits, and how much her cooperation is needed for a successful MRI breast biopsy procedure. Prior MRI images are reviewed to decide about patient positioning, access side, and placement of the fiducial marker. In this case, the lesion is located centrally in the right breast and external access is chosen. Measurements are taken of lesion size, lesion number 1. Distance to the already biopsied lesion, lesion number 2, and distance to the skin, access side. Prior dynamic subtraction sequence is reviewed to decide the location of the fiducial marker, which is placed on the skin after the breast has been positioned and compressed around the lesion coordinates. The fiducial marker is used as a reference to confirm the lesion coordinates and the entry site on the skin. The injection pump syringes are filled in with saline and gadolinium contrast media, and safety checks are performed to remove air. The vessel is prepared for contrast media injection and saline is injected to check vessel permeability. Breast skin is disinfected. Patient is placed prone on the MRI table. Right breast is placed in the dedicated right coil slot to allow external access. The Sentinel interventional grid is used. The compression grid is moved manually so that the breast lesion is accessible and the breast is compressed. The fiducial marker, vitamin A plus E, is placed on the skin, around the lesion coordinates. Use the Sentinel interventional grid template, patient view, to mark the square and precise location of the fiducial marker, that is, within square number 11. Injection pump tubing is connected to venous tubing. Patient enters the magnet bore for acquisition. A sagittal 3D fat-suppressed T1-weighted gradient echo sequence is acquired. Injection is completed after the first sequence. Injector is set up for gadolinium injection, followed by saline injection at 2 ml per second. Sagittal volume is displayed to find the fiducial marker within the grid. The Sentinel interventional grid template, image view, is used to mark in square 11 where the fiducial marker is placed according to the image display. Lesion coordinates versus fiducial marker coordinates are checked on the dynamic sequence with contrast. The Sentinel interventional grid template, image view, is used to mark the square and precise location of the lesion, which is square number 11, D1. Locate D1 on the grid, patient view, to find the orientation for inserting the needle guide block in square 11. Axial subtracted sequence is displayed. The lesion is found, and distance from the lesion to the skin is measured. The value is annotated on the Sentinel grid template. 2 additional centimeters are added to that value to give the depth of the VisiLock MRI introducer that will guide the probe to position the lesion in the middle of the EnCor probe notch. The VisiLock MRI introducer kit and the anesthesia are prepared. The fiducial marker is removed and anesthesia is introduced at square 11 D1 coordinates. A skin incision can be done as required, but is not necessary for the current procedure. Set up the VisiLock MRI introducer set according to the introducer depth found before. The cannula stop is placed at 4.54 centimeters in the cannula marking. The trocar is fully introduced into the cannula. Verify the final setup before the needle guide block is inserted in square 11D1. The needle guide block is inserted, unlocked position, in square 11D1 orientation. Move the lever to the locked position. VisiLock cannula with the trocar is inserted and fixed in position using the cannula stop. The trocar is removed and the VisiLock obturator is fully inserted for the MRI imaging check. The VisiLock obturator MRI visible end indicates where the middle of the notch would be while sampling. The just acquired MRI images are reviewed. The end of the obturator and the lesion are displayed. Compare their coordinates. In this case, the VisiLock obturator is in the lesion, so we can proceed with probe insertion and sampling. One full EnCor pattern followed by a second half pattern will be completed. The half pattern is orientated, as the enhanced area is towards the nipple side. The 10G EnCor probe is attached to the MRI EnCor driver. EnCor is ready for full pattern, normal tissue, full notch samples. VAC, quickly followed by sample driver buttons, are pressed to rotate the notch 180 degrees so that the 12 o'clock sample faces towards the chest wall in this case. VisiLock obturator is removed while keeping the cannula and the cannula stop in place. Sampling is started and full pattern completed in a few seconds. Half bottom pattern nipple orientation is set up in the EnCor touch screen. Sampling is completed. Senomark ultra-core breast tissue marker is prepared. The tissue marker will help to locate the biopsied area afterwards when needed. The two red indicators in the tissue marker applicator must be aligned for deployment. The tissue marker applicator is introduced through the cannula, making sure the two red indicators are aligned. Push the applicator firmly all the way so that the tissue marker is deployed in the biopsy coordinates. Once deployed, the applicator is rotated to make sure removal of the applicator does not displace the tissue marker. A new sequence is acquired to double-check tissue marker deployment coordinates. Check tissue marker and placement of the VisiLock obturator on the images. The MRI biopsy exam has been completed successfully. The patient breast is released and breast compression is applied to avoid bleeding. Manual compression and cavity drainage maneuvers are done in the biopsy area. Ice is ready to be placed over the patient breast. While patient care actions are in progress, samples are carefully deposited in the dedicated container. Push the container cover down firmly to ensure the samples are covered with formalin. When bleeding stops, the breast is cleaned and wound closure strips are attached. The entry point area is covered with an adhesive gauze and a compression bandage, which is removed after 24 hours.